Some women have naturally large breasts. Large breasts can cause a lot of discomfort, including severe neck and shoulder pain for prolonged periods. Women with this condition experience a great deal of physical and psychological discomfort, especially when they see other women around them with more shapely figures. So what can these women do to get breasts that do not cause them discomfort? How can they regain their confidence in the presence of others?
We get a lot of patients with huge size breasts or increased size breasts, and it is not only a social embarrassment for them and it's difficult for them to find clothes and all, but also they have a lot of severe neck pain and back pain. In fact, you will find a lot of women who have enlarged breasts, they walk with a slight stupor, right? So they are bending forward, and it has a huge impact on their backbone. In fact, many times, many of our patients are referred by an orthopedician. So they go with a complaint of back and neck pain to an orthopedician, and he sees that they have actually a problem of huge breasts, and then they refer the patients to us. So apart from being a cosmetic issue or a social issue, it is also a problem because of back and neck pain. A youthful breast should have a good volume, perky looking breast sitting atop on the chest. It should not be hanging down with its weight. So it should be appropriate to the size of that body, considering the shoulder and the pelvic size, so that it looks harmonious on that body. And the nipple and areolar complex, or an NAC complex that is called, should be pointing front. The upper poles should be full. So a lot of females will have flat upper poles or a big lower pole. The upper poles should be reasonably full. NAC pointing forward. Their cleavage should be nice. The medial pole should be filled. The breast should not be jutting out outside the bra. These are the considerations which are there in a youthful breast, and we take all these considerations when we design a new breast after a breast reduction surgery. Usually the surgery time is around 2 hours or less than that, and the patient goes back home the same day evening after a few hours of observation. And there is no too much of problem in them resuming their daily activities. And the patient does not have any pain from the same day or next day of surgery. They don't have actually any pain. They are very comfortable. There is a kind of a skin stretch feeling because now we have reduced the size of the skin and the breast tissue, and the breast has gone up on the chest. So obviously there is bound to be some stretchiness or a discomfort kind of feeling because of that. And for that we give a basic painkiller like diclofenac sometimes, and we don't need to give a stronger painkiller also. They just have to avoid heavy weightlifting exercises over their heads and wear a sports bra for 6 weeks. These are the 2 precautions which needs to be taken care of. Many times we get individuals, females, who have enlarged breasts in their teenage, and they come to us with a lot of concerns whether they get a breast reduction surgery done now and then they'll get married and they will have kids. So the technique we use is a short scar technique with enough pedicle kept intact. Now what this does is that it prevents any problem in future lactation. Your lactation potential is maintained. Okay, the procedure is safe if they get it done by a good plastic surgeon in a good hospital who understands a good sense of breast aesthetics beauty. So a good plastic surgeon will take care of all the precautions which needs to be done before any surgery like this.